Hello, good day everyone. Welcome to MAHSA Education Fair today. So I'll be sharing you on the education and career pathway in medicine today. So may I introduce myself? So my name is Dali Kindali. I'm a pathologist. I'm working in the MAHSA University, Faculty of Medicine, Bioscience and Nursing. So today we will talk about why medicine should be a career choice for younger generation nowadays. So career opportunity for MBBS and things to consider when you involve in this medical field or when you embark on this pathway, and what are the job opportunity for the doctors, and for example, for instance, in MAHSA University is accredited and the recognition all over the world internationally. And how we practice here the mode of learning delivery, and then our facility and the professionally, what personal professional attributes are required for a good doctors. Also, I will explain about that, and how do you need to be learned for the medical program. So let's see. Career opportunity for the MBBS. Maximize. Maximize. Clinically, we are training for the student for how to save the life of the patient. So we have to be communicate, and we have to involve in the hospital all over the world. So clinical practice, academic career, clinically, the doctor should be professionally. How should we take our professionally detective also with dignified, with the integrity. So defense medical service, also we have to know about the laws for each and every country. Medical law, ethics, medical jurisprudence, then a hospital management. So the some of the doctor, one day they can be the chief commander leadership in the hospital, and medical education as well. So we also involved in the scientists research like that. So medical insurance also need to be the cost effectiveness. Then also the which countries, there's so many countries are using the many currency, but after this pandemic also, that the insurance system is also very important nowadays. And pharmaceutical industry. So war is a day by day is changing. So many new drugs are coming up because new bacteria, virus, microbiological, the organisms are also updating based on their antigenic shift, antigenic drift. So that's why pharmaceutical industry are also play an important role. So why do people choose medicine? Primary driver must be pensioned like a pilot as for opportunity to make the changes in the people life by relieving pain and suffering of the patient. So the medical doctors are the primary driver. So career option for a qualified doctor varies in so many levels. So variable day-to-day schedule with a practically intellectual challenge are coming up. So our profession is a respective profession with a reasonable remuneration. So there's always need for a doctors. So things to consider when you embark, when we are involving in the medical fees on this pathway, how to prepare to become a doctor. So first of all, entrance qualification and the long hours of the study, We must be conduct as a professionally the resilient and needed when dealing with the challenges curriculum, because medical fee, medical textbook, medical terms are more difficult than the other professional. So the emotional resilience needed when dealing with the consequences of the illness, pain, suffering, disability, and the death. The need to move while training and beyond as well. The cost. The cost of the medical program is a little bit higher than compared to others. Then the pressure of the training and study after undergraduate years as well. So when the MBBS degree or MD degree is older, this is the beginning of the journey, only beginning, starting. It will be took off, but if they are not yet specialized in any field, so job opportunity in our medical fields has a forensic laboratory, medical and health service, health education, educational system is after pandemic already updated and is changed, not like old time. So there's a technically already sophisticated, and information technology is also, as we must learn as well. So many social media application can be able to use. So informations are the patients also they can get it easily. So we must have a knowledgeable. Then the job opportunity, other things are the hospital can also we can have a job, and research institutions. So we also concurrently doing the research as a scientist and pharmaceutical company. These are the listed below in the job opportunities. Here, I'm here in Malaysia. So the sample of the rather than other country, I know about the Malaysia. So Malaysian scenario is here. So professional registration and internship with the MMC Malaysia Medical Council. So the currently serve a 3 to 2 years contract, and we are stable. So compared to other, because nowadays has a little that financial problem. Each and every country has some political change, but private practice also you can be able to get an employee. So the job security of the job security is no need to worry about for the medical doctors. So we have this is the ratio. So our university also accredited recognition also got. We will have a hospital soon. And in our university, this is a mode of the learning. So we have an objective, goal, vision, and mission to be cope, and which topic we have a curriculum. Also, teaching learning strategies we have updated based on the nowadays that updated curriculum string. So we do properly assessment to be qualified doctor. So they will get a license. So that is why assessment must be strictly to be checked as well. Is there demanding for doctors nowadays? Answer is yes. So there will be always be the government of the Malaysia also recruit all graduates of the medical program, and there's a good scope of the private practice as well, and high demand for doctors. So especially after pandemic COVID-19, doctors are the private practitioner are among the highest earning professional as well, compared to the other professional like an engineer, lawyer, pilot, business. Anyway, so the earning also the topmost. So what is the career path? Career path is, first of all, undergrad is the MBBS holder. So this is generally the MD program and MBBS with Bachelor of Medicine and the Bachelor of Surgery. So the both those two fields can be understand, then only they can able to get a license. So after beyond that undergrad, there will be the post graduation. So the postgrad is a specialist, which is called here is the pakka. So the specialist is like a physician, surgeon, pediatric is the child specialist, and orthopedic bone specialist, and super specialty also the cardiologist, and public health manager, and medical scientist. So what personal professional attributes are required for the good doctor? These are the doctor must be knowledgeable, ethically practice. Doctor must have the emotional quotient must be high, and commitment, dedication, emotional mental strength must be stable. Then it should be the 100% free of mistake, and it must be the good leader, good manager. So this is what do we learn in MBBS course. We train the first basic the medical science. So these are the outline for the what we have currently block modules by module we conducted. So there will be integrated teachings for anatomy, physiology, biochemistry, pathology, microbiology, pharmacology, and public health. So we also concurrently running the professional development for each and every student. After that, so the doctor should be understand system-wise as well. Like cardiovascular system, in our body, all organs are important. Heart, blood, reproductive system, endocrine system, lungs, blood, there's a hematology we call it. And then kidney, brain, central nervous system, GI tract, digestive system, bone and skin, musculoskeletal system. So all these are the course what we are training for the student. Then specialty are medicine, surgery, obstetric and gynecology, and other how to do research, including the mental health, psychiatry. These are the course for 5-year journey. So implementation plan phase 1 will be include year 1, year 2. Then phase 2 will be year 3, 4, 5. This is currently what the student can be learn in medical program. The facility what we have is here. So what should be the personality of the medical lecturer? So attire also very important for the doctors. So doctor must be smart. Professionally must be the personality must be the better, and compared because the doctor should be qualified, knowledgeable, skillful. The surgeon must be skillful. If not, if he doesn't know what to do, so after open the abdomen or the chest, so it must be closed, reclosed. So it must be experienced, that understandable, and before they become a surgeon, so they must have the mentor who is guiding in the good leader. Then they should have a confidence and patience. They must have a forgiveness. And professionally and ethically, and source of inspirations are come from the doctors and the lecturer. So what should be the personality of the medical doctors? Here is listed. So this is our curriculum are innovative, and it's integrated teaching. Then the lecturers here will qualify, facility very good. Here, okay, this is our library. So nowadays, if we don't understand about the learning management system, it cannot. So that's why internet facility learning management system must be lecturer must uploaded the lecture and easily accessible, because the student have a mobile phone everywhere. So innovative enhanced teaching learning method are we used. So we have an interactive section with student and the lecturer in the free study time as well. This is how we conduct computer assisted learning system. So these are the hospital attachment with us. So this is some our advantages where we are here. What exactly the doctor educational our career opportunity, the purpose is we coaching, we show the best utmost assessment. We also monitor day by day, moment by moment. Then structure is with the professional outcome, outcome-based curriculum, and competence must be there. And we also use the evidence-based medicine. Then interaction also we do because the doctor must be smart. So portfolio. The portfolio is a collection of the result and evidence of what we usually plan the action discuss. There's also peer review there. Supervisor when they do the research. Then also we used to do the reversal from the burden of the evidence as well. So planning first, then discuss, and we also listen for the student feedback, reflection, learning portfolio, then assessment. So assessment portfolio also be recorded properly, and ID portfolio will be get it done after the course of the 5-year journey. Okay. So thank you. If you have any queries or questions, drop in your our inquiry at our social media inbox. Have a nice day ahead. Thank you.